wonderful gentleman, Buckeye gentleman, right?
Yeah.
We are putting in Liberty High Torrent. Just remove the very dense cataract. You can see how small the pupil is from prolapse. And we have to fashion our access accordingly. But no matter how complex the patient situation is, remember, you don't decrease your artistry, right, doctors? That's what the
This is Buckeye from Ohio. How did you do, Rob?
Good. Good.
How was the experience?
Good. I mean,
Yes.
you've heard it all.
Amazing. With all this hard cataract and stuff, he's all done. Very proud of him. Rob, look up there. Can you read anything?
I have Gulani vision. That's what people are reading off of.
Come on, careful. Great. Rob, have you noticed your reading has also improved?
I can't use my eyes.
Don't move.
You keep throwing it.
Yes. Just stop. Look open. And no stitches. And doctors, here's a beautiful case of Vivity, as you can see there. X-wave technology for this wonderful gentleman. You can see the perfect centration right there. Also high toricity corrected in the patient. Very well centered.
How do you know how to test it?
No testing. Logic.
Really?
Logic. So all of you that I did yesterday, very complex cases you saw from all over the world. Yet how was the experience?
Yeah. Great.
No hospital feeling, you were in a surgical
Yeah,
spot.
yeah, it was nice.
And you walked out, no stretcher.
Yeah.
And no stitches. And the technique of how we have put in this X-wave technology for your kind of
Yeah, no pain.
the work that you do all over. So all these are important. It's just applying the logic and technology to what's best for you.
Yeah.
That's so simple. Okay, great. So doctors, you can see the X-wave technology here in perfect position in this patient with extremely posterior astigmatism, and we have placed it on axis in a high toric impact. Excellent. Sit back, please.
You did a great job.
Excellent. Take care. I'll see you guys. You're doing fantastic. Perfect. So here we are in a wonderful gentleman putting in a high toric carry-on lens technology. Patient has extreme hyperopia, shallow chamber. You saw the pupil, floppy iris, and here we are going in. And despite the small pupil, we are manipulating the optics and anatomy. And as all patients of ours, there is no anesthesia. Numbing drops. Well, how's your comfort level?
Good.
Wonderful. And also, some of our patients today are actually very apprehensive, and yet you can see how calm they are. And I'm inside their eye. Rob, anything you want to say about your experience? He's come here back for his second eye.
Yeah, no, this is great.
Wonderful.
No pain.
And I'm still in your eye. Going inside, back in your eye here. Beautiful. And there we are, doctors. You can see this way of operating, especially in office-based techniques. It makes you an even more sensitive surgeon because the patient is with you. Right, Rod?
Oh, yeah.
And again, as you know, all our patients travel from far and wide. They're very, very intelligent people. They've done their research, so they're watching everything. And I'm okay. You can see here again, we're being very finicky. You can see the mark on the cornea, and you can see the mark on the lens underneath. Very finicky. Polish. And we're cleaning up the differential polishing technique that I do to make sure the lens doesn't rotate because of high toricity. And we have corrected his corneal abnormality with a lens-based technique given his age and concept LenzoPlastique. And as usual, we come out without a stitch. All done. Congratulations, Rob.
Oh, that's great. You got the cataract too?
Beautiful. Fine. You completed your surgery. How was your experience?
Excellent. Did you get the cataract and
And everything, your shallow chamber, your cataract, your small pupil, your astigmatism, your presbyopia, your distance farsight, everything done.
You're my hero. That's excellent. It didn't hurt at all.
Congratulations.
Thank you.
Here's your second eye done, cataract LenzoPlastique based, no anesthesia, just numbing drops. How do you feel?
I feel great now. I'm pumped. Man, I've already, my left eye, I see so much better. Now it's right. Man, I feel confident I'll be 100%.
Mr. Buckeye.
Somebody, and everybody keeps telling me stigmatism is bullshit. You can get them out.
Mr. Buckeye,
Hey!
how do you feel?
Honey.
Good. Feel great.
Second eye down?
Yeah. Yep.
Oh, lovely.
Yeah. That was great.
Again, Rob, you are specially apprehensive, right?
Yeah.
And how was the experience? No anesthesia, no IV, no medication, no drugs, just drops and your complex eye.
I feel fine.
Yes?
And last time we put stuff in.
Rob, can you see up there?
I have Gulani vision.